In today's Health Alert, Catherine, the Princess of Wales, is revealing she is undergoing preventative chemotherapy in this pre-recorded video you're just seeing there. In a statement, she says that she shared her cancer diagnosis that resulted from tests conducted after she had abdominal surgery in January. So to understand what is preventative chemotherapy, let's turn to our chief health editor, Dr. Partha Nandi now. And Doc, that preventative chemotherapy, that clinical term? No, what's this all about? Tell us.
Yeah, this term is technically not a medical term, right? In the medical community, we use the word adjuvant chemotherapy. Brian, essentially it's a treatment to prevent cancer from returning, and it's often given after the primary treatment like surgery. Now, you may be wondering if the tumor or cancerous cells were surgically removed and gone, so why go through this adjuvant chemotherapy? Well, surgeons can only take out what they can see. So it's possible that microscopic cancer cells are left behind. So there could be other cancer cells also circulating in the bloodstream or what's called the lymphatic system. And without treatment, cancer can return. So preventative chemotherapy can reduce this risk. Why? Because the drugs attack rapidly dividing cancer cells throughout the entire body. Now, that's not to say that adjuvant chemotherapy is a cure-all. It is not, and results depend on the type and stage of the cancer being treated. Every patient must consider the pros and cons because chemotherapy, guess what, can also damage normal healthy cells in the blood, the mouth, the digestive tract, reproductive system, and even hair follicles. And this could lead to side effects, and we've heard about that, right? Nausea, vomiting, mouth and throat sores and hair loss. Patient can also experience being fatigued, have headaches, diarrhea, and blood disorders. Some chemotherapy drugs can also cause long-term effects such as heart or nerve damage and fertility issues. So it's no picnic, but I think it can be helpful.
Okay, so Princess Kate, she's just 42 years old. I know that we know this because we see pediatric cancer, so the whole spectrum.
Yes.
So cancer knows no age. But given her age, what kind of cancer could this be? Because Kensington Palace hasn't said.
Yeah, vitally important point you're talking about. A recent report from the American Cancer Society, and we talked about this, revealed cancer cases are on the rise in younger adults under the age of 50. As for Princess Kate's potential cancer diagnosis, got to think about colorectal cancer as a significant possibility. I'm seeing a growing number of younger patients diagnosed with this type. It's becoming the leading cause of cancer death for men and second for women under 50. However, other GI cancers include the stomach, pancreas, liver cancer. It could also be a GYN or gynecologic cancer like cervical cancer, uterine, ovarian, or vaginal. The good thing is that adjuvant chemotherapy, Brian, it's very effective for bowel cancer if that's what she has. Of course, this treatment approach may also be recommended for other types of cancer. Irrespective of the specific cancer the princess is facing, we all wish her a full recovery and let her journey really serve as a reminder to all younger adults. This is really important to promptly seek medical attention for any unusual or concerning symptoms. A lot of my patients blow it off and then they come in too late, and we can't do as much as we could if they came in earlier.
And I'm sure what type of cancer will affect what the prognosis and the outlook of her.
100%, 100%. They're not telling us that right now, but whatever it is, I think the adjuvant chemotherapy will be helpful.
Okay, all right. Dr. Nandi, grateful as always.
My pleasure.
Thank you.
Of course.
If you have a health question for the doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or Twitter.